Bismillahirrahmanirrahim. Today we will be performing cover tests, and please try to concentrate on each and every word which I am speaking, because I am uh, choosing every word very carefully. So I spoke cover tests. It is a term which is a broad term. There are many types of cover tests. So first of all, cover tests are performed for the evaluation of a case of squint or strabismus. Now what is squint? Squint is defined as misalignment of the visual axis. For example, what is visual axis? Visual axis is the axis or line from where the ray of light passes into the eye. So these are the normal eyes, and if one eye is deviated inward or outward, this is misalignment of the visual axis. Got it? So this is squint or strabismus. For evaluation, we perform cover tests. Now, cover tests have different types. Number one is the cover tests. Number one test is cover test. Cover test tells us manifested squint.
Manifested.
Yes, which is already manifested, which is visible even without performing the test. Second test is the uncover test. Uncover test tells us the latent squint, which is the hidden one, as the name is telling you. And the third test is cover uncover test. It tells us manifest plus latent squint. I hope it is you will not forget it. Okay, so cover test, uncover test, cover uncover test. No, sorry, cover test, uncover test, and alternate cover test. Not cover and cover. Third is the alternate cover test. Alternate cover test tells us both manifested and latent squint. So how do we perform? We must have an occluder, and you will ask you perform it for 6 meters, you perform it for near, you perform it in different gauges, for right gaze, for left gaze, for up gaze, for down gaze. But for your level, at undergraduate level, I will perform for far gaze to let you people know how it is performed. Now just imagine आप दोनों उधर देखें सीधा and assume that is the uppermost letter of the Snellen chart. Now in this test you must tell the patient a specific target. See that T on the Snellen chart. Why specific target? Because he will accommodate the eyes at some particular, or if we are doing it for near, you will ask the patient to see at the tip of the ball point. You will not say look at the ball point, tip of the ball point. So he deliberately focuses with the accommodation, because the thing to remember is the principle of cover test is that we break we dissociate the two eyes. We normally both eyes function in association. one eye move here. You cannot do this that one eye move here and the other goes there. Both eyes go at the same place. But in cover test, we break this association and we dissociate it. So now let's assume that he is having divergent squint of this side. So when he will enter into your room, you will come to know that he has divergent or convergent squint. So for your understanding, आप जरा यहाँ पर देखें इधर सर नहीं लगा इधर 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 देखें इधर. Now you people make a picture in your mind that this eye is straight. Okay, the right eye is straight and left eye is divergent. When you will imagine it, then you can see that the patient has the divergent squint. But to confirm whether it is a divergent squint or it is some besides squint, what can it be? It can be entrapment of the muscle in some trauma, in road traffic accident. It can be some nerve palsy, for example, third nerve palsy in which the eye goes out. So to rule out these things, you will perform the cover test. So उससे ही देखिए आप, जब मैं आपकी आँख आगे टूटे रखूँगा ना, आपने आँख सीधी रखनी
इस तरफ देखें
नहीं, अभी उधर देखेंगे. जब मैं टूटे रखूँगा आपकी आँख के आगे, when I will place the tutor, आपने एकदम सीधा करना है, ठीक है? Okay. Now see at the Snellen chart. इस आँख से उधर देखिए. Now this is the patient of squint. This eye is straight. I will place the occluder on the normal eye.
Yes.
Okay. So I will place the occluder on the normal eye. See straight. Now that eye has moved inward. Now you will uncover this eye will remain at the same place. Now if it has come inward from outward, obviously it is divergent and the vice versa. As the patient at this time the patient of squint is not available, so I have made a scenario of a squint by asking him to act like that. Understood?
Yes, sir.
Now what is uncover test? Uncover test is for latent squint. So see at the uppermost letter T, and I will in cover test we place the occluder on the normal eye, and in uncover test both eyes will be straight because it is latent. So you can place the occluder on any eye. So for I place the eye occluder on the right eye, and when I will uncover, I will see the same eye.
No difference.
No. Just stop at this point. In the previous test, we saw the other eye. We placed the occluder on this eye, and we saw the unoccluded eye. Not normal or abnormal. We saw the unoccluded eye.
Okay.
In this case, we will place the occluder on any of the eye, and when we will take off the occluder, we will see the same eye,
Okay.
and we will see any movement. So see there, and I found that there is small inward movement. I see, you cannot see from that far. You cannot see from that far.
I cannot understand आप क्या कह रहे हैं at all.
I mean to say,
शुरू से बताएं सर.
I mean to say कि in uncovered test, I am asked, have given the target.
Yes.
Now I am placing, for example, he is having a latent squint. This patient is, for example, is having latent squint. Not everyone has the latent squint. Then I will place the occluder, and latent squint is really bilateral.
ठीक है.
I will place a occluder and he will see this. Now I have dissociated both eyes.
Okay.
Okay. Now when I will take off the occluder, because this eye is occluded, it will not remain aligned to the other eye because of muscle instability. When I will take off the occluder, then it will take up the fixation suddenly.
Okay.
Understood now? Because when it was not seen, it was wondering where to stay. But when I took off the occluder, the eye suddenly took the fixation when it found the target, right? So it is usually a very small movement, and latent squint is very small and hard to appreciate. So now come to the alternate cover test. Alternate cover test is that, for see here the upper T, I will place occluder at one eye, then at here this side for 2 seconds, 2 seconds, for 2 seconds, and in this case you will see any movement in any of the eyes. In a patient with manifest squint in one eye or both eyes, for example, this eye is divergent, you will perform the alternate cover test, there will be no change, this eye will remain divergent, there will be no change in alternate cover test. When you will place this here, it will become, take up the fixation. When you will close this eye, it will already be straight. The status will not be changed. Understood?
Manifested में.
Manifested. And in cover and covered, and in uncover, alternate cover test, if the manifest squint, there will be, if there is no movement, then it means there is no, it is very confusing. It is squint is perhaps the most confusing topic in ophthalmology. Squint and neuro-ophthalmology are the most confusing topics. So I will try my best to explain it. I will explain it again for you. So it's your first time, so it's creating difficulty. So in uncovered alternate cover test, in normal patient there will be no movement of any eye, and in latent squint, which is usually bilateral, there will be movement in both eyes, but it will be very slight. It can be from outward to inward, and or inward to outward. Understood? That is, it will slightly come when I will come here, it will come inside or it will come outward or inward. Now, the manifest squint is called exotropia, and latent squint is called exophoria. So the last thing which we checked, the small movement, it is exophoria, very small movement.
Latent squint.
Latent squint. It is phoria. It is not tropia. Tropia is manifest squint and phorias are latent squint. And these are the basic cover tests which contains 3 parts. And I will close here. Thank you very much.